Good afternoon, everybody. It's Dr. Nenshi, and I am here on our regular weekly Wednesday webinar to talk about the Right Orthotics For You. So today's topic is going to be basically discussing what orthotics are made of, what they're useful for, and what are some of the things that you might find useful if you are considering getting orthotics. So we specialize in correcting posture and improving joint function to reduce pain. That's what our chiropractic clinic focuses on. And I know from experience, we've been utilizing orthotic therapy for helping a variety of conditions for many years now, going on more than 21 years. And we've helped people who have had migraine headaches, to low back pain, to knee injuries, runner's knee, plantar fasciitis, bunions, Morton's neuroma, diabetic neuropathy. The list goes on with all of the different conditions that orthotics can help with. And many people don't realize that chiropractic care is related to orthotic health, but it is a very effective way to relieve pain and prevent future damage. So in addition to correcting an actual foot injury, by correcting your arches, if they are fallen, it can really help to alleviate other bodily pain as well. So before we get into all of the details of that, I'd like to just talk about the anatomy of the foot. And the human foot has 26 bones, 42 muscles, 33 joints, and at least 50 ligaments and tendons. And all of these elements make up the toes, the heel, and the ball of the foot. And it helps you from contacting the floor and moving your weight through your foot to step onto your second foot. So it's just your ability to balance on such a small area at the bottom of your feet to propel you as you move through life. And each piece of your foot has to stay healthy in order to help handle the hundreds of tons of force that your weight creates by moving. So this is an example of a foot, and we call this portion the heel. You got a heel strike, you got your mid stance, and then you toe off. And they say there's about a quarter of the bones in your body in just your feet. You can see how many different bones there are. There are 3 bones in each toe, just the toe. So it's pretty amazing how much flexibility you need in order to maintain your balance and be able to move through your life. So many foot problems can develop because of neglect or poor fitting shoes or just simply wear and tear. So orthotics are devices that are worn in order to correct the foot and ankle conditions without surgery. So it's the first step in managing foot and ankle and knee problems before you go in and try a surgical approach. And orthotics can include devices such as foot pads and shoe inserts and ankle braces. Foot pads are usually in line of defense when people are experiencing basic foot conditions. It's like the first line of defense. And they can be purchased from many places without any doctor's recommendations. A common example could be like those circular pads that you put under a callus or a corn. Shoe inserts are cushioning placed in the shoes, and inserts can be used to treat a variety of issues, ranging from arthritis in the feet to flat feet. And you can purchase them readily right off the shelf, or you can have them customized and specifically shaped for your foot. Ankle braces can be used to treat a variety of diseases like ankle arthritis and foot drop and tendonitis. So those are devices that will actually support your foot and prevent your foot or your toes from dropping down. So if you've experienced foot pain, you've probably spent a lot of time walking through the health aisle where they show a lot of foot products. And there's so many options, it can be challenging to know what's right for your specific concern. So I'm just going to give you a couple of tips when you're going down the aisle what to look for. So if you have a challenge that is because you have a specific health condition, so for example, do you have diabetes, like diabetic neuropathy in your feet? Do you have problems with circulation? Or for a health concern, you know, pronation? I think that it's very important to consider getting an orthotic that will fit your specific concern. So long-term health issues actually need long-term foot solutions. So in this sense, custom orthotic therapy would probably be most valuable in trying to help you with your specific concern. If you have a specific activity that you're trying to engage in, so let's say you're planning to do a marathon or you need a little cushioning for your work shoes, then you can choose a product that's going to be based on your planned activity. So that might be something like a little cushion insert that you can put in your shoes. It may not correct for your arch, but it adds a little bit of cushion. So when you're looking for a cushion insert, one thing to remember is make sure you bring the shoes that you're going to wear them in, bring them with you, so that your orthotic can be fit inside the shoe and be the right size. And you may be able to try them on or find out what the store's policy is for returning them if they don't fit into the shoes that you have. So custom foot inserts are individually molded to support and correct and prevent foot abnormalities or deformities. So there are various practitioners like chiropractors, podiatrists, certified podorthists. These all can make orthoses. So the process is, first of all, we need to figure out what's going on with the foot, and then we need to cast your foot. So the first thing we need to do is, in our office, we have a computer GaitScan. The GaitScan measures, has thousands of sensors on it, and it measures just how much pressure you put on different parts of your feet. It measures the timing of when the foot bones come in contact with the floor. It's more than what your naked eye can see when you look at someone walking across the hall. So it's very detailed amount of data that is collected with these, with the GaitScan. And again, it just measures how you're standing and walking. And then these measurements are sent out to the lab to produce the orthotic. Most orthotics are made out of semi-rigid material. So the ones that we make are made out of semi-rigid material, because if you have a very rigid orthotic, you're not going to be able to keep your muscles engaged when you're walking. Certainly you can move your body and change and shift your weight on your foot, but the actual arch support, if it's taken up by a rigid orthotic, then why should your foot muscles have to work to create an arch? So we believe that if you use a semi-rigid material that's somewhat flexible but still rigid, that it will support your arch and then never let your foot muscles get lazy. The other thing to note is when we make the orthotics, we use a foam cast. So you don't have to put your foot in a specific position for several minutes. It's just very quick. We can cast your feet within about 5 minutes and be able to determine where exactly the abnormalities and deformities are in your feet just from that neutral cast. And that cast will be sent out to the lab as well with your computer GaitScan data. So who needs orthotics? Custom orthotics are used to correct a variety of biomechanical foot issues, such as problems with how you walk or stand or how you run. There are custom orthotics that can help with foot pain from medical conditions, such as diabetic neuropathy or plantar fasciitis, bursitis, and arthritis. And in some cases, orthotics can be used to help you avoid surgery in order to fix your flat feet. So orthotic devices can be used for several reasons, and they can be for aligning and supporting the foot or ankle. It can be for preventing or correcting or accommodating foot deformities. and overall improving the function of your foot and ankle, making sure that you have the flexibility that you need. So there are two primary types of orthotics. The first, there are two different types of orthotics, and the right one depends on why you need that orthotic. So for example, if you need to decrease the shearing forces under your foot, it might be nice to have a softer material underneath or a cushion that can really enhance your comfort. And so you can use a cushion pad or other things to help relieve pressure from painful or injured areas at the bottom of your foot. And this type of orthotic is a little bit more flexible and softer than the functional orthotics we talked about. And you know, because they are softer, they don't provide as much support in the arches. On the other hand, if you need to control abnormal foot biomechanics, such as when you're running, you might be overpronating, which basically means that your arches are falling. Some people have the opposite, where they have very high arches and they're supinating. You may require more rigid orthotic. And remember, you know, when we make our orthotics, we try and use semi-rigid graphite or plastic materials in order to maintain the shape of the orthotic and give you the support without overtaking your foot function. So there are specific conditions that can help, or that orthotics can help with. So bunions, if you have shoes with a wide toe box, you can use a bunion shield pad that can help alleviate some of the discomfort from that. The corns and calluses that people may have, you can have like a toe separator that can help with that. Cavus foot or high arches, you can use soft orthotic cushions to distribute the pressures evenly throughout the whole foot. Flat feet, you can use a semi-rigid insert like we had shown earlier, or you can use a longer arch pad with a heel wedge. And this heel wedge prevents you from rocking your heel as you walk. If you have a stiff big toe, perhaps you can use a stiffer insert. Hammer toes, you can use shoes with a wider toe box. Plantar fasciitis, you can use the heel insert, such as a big cushion in the back of the heel, so when you're walking, you don't hit the ground very hard. And then runner's knee. Runner's knee is really great because you need orthotics for runner's knee, because when you run, you move your weight from your heel to your toes very quickly. And so instead of having a regular length orthotic, you want to have something that is shorter so that you can move from, you can have the flexibility you need in your feet when you're running. So we actually have special orthotics designed for runners that give you the cushion you need, the support you need. It's a full-length orthotic, so it fits nicely in your running shoes. And it's a shorter orthotic too, to give you the flexibility that you need. So we previously mentioned that you can use functional orthotics to correct abnormal foot function, and there are a variety of painful conditions in the foot and lower extremities that can be helped with this. So pain in the arches, ankle pain, heel pain and tendinitis, bursitis, conditions of the ankles, knees and hips, shin splints. The advantage of having a specific functional foot orthotic is that it's very durable and you don't really need to make too many adjustments on it. It's likely to fit into a lot of your standard shoes, and they're very thin. So it doesn't take up much room at all in your shoes, but it will support your weight. There are other types of orthoses. Accommodative orthoses are useful in the treatment of painful calluses or on the bottom of the foot. If you have diabetic foot ulceration, sore bones in the bottom of the foot, or other types of foot pathology. So the advantage is to have a relatively very soft and forgiving cushion that can adjust easily in shape in order to improve your comfort. A disadvantage, of course, is that these tend to be relatively bulky and they're not very durable. You always need to adjust them in order for them to continue working properly. So when you first make that switch to orthotics, it may feel uncomfortable when you begin wearing them because you're changing your foundation as you walk. And think about your kinetic chain, which is how your muscles contract from your feet all the way up into the rest of your body based on how you walk and the forces that you place on your feet. So it's possible that you may experience some soreness in the surrounding muscles once you start wearing orthotics that you probably never felt before. And your body is just basically compensating for trying to, all these years they've been compensating for being in the wrong position. So we're trying to actually correct and align the posture better so that these muscles that may be contracting asymmetrically are starting to work better. So as the body adapts to change, there's going to be some discomfort, but the body is going to adapt quickly. And usually we see that any symptoms that start from wearing orthotics usually go away in a relatively short period of time. So in the beginning, we suggest when you get your orthotics, you wear them for maybe an hour or 2 hours. And then every day you just increase them a little bit, increase the time by about an hour a day. So by the end of 2 weeks, you should be wearing them full time and they shouldn't be bothering your feet. If the orthotics start to hurt you for whatever reason, just cut back on the time that you wear them. And when you're wearing your orthotics initially, when you're starting, avoid wearing them when you're playing sports or during workouts or other strenuous physical activity, because that just means you're going to have more impact on your feet and you're still trying to get used to the correction. So it's best to introduce them into your sports after you've gotten used to wearing them just with regular walking. So your feet are the foundation for the rest of your body. And if your feet have problems, the rest of your structure no doubt is going to be affected. So often your feet are the reason why people have knee pain and hip pain and leg pain, lower back pain, and in some cases even neck pain and headaches. So there are a few benefits for using custom orthotics. First of all, your foot support. You have enhanced foot support. Your feet are amongst the most complex part of the body. Again, 25% of your bones are in your feet. And so they bear the weight of your entire body. So orthotics provide your foot with a solid foundation to help support your foot so that you are able to load all of your weight on your body functionally, that's working properly. So clinical studies show that prescription orthotics decrease foot pain and improve function. People who have pronation, you need to correct the weak arches to allow the ankle to fall inward towards the midline of your body. And so what happens is when you have pronation, instead of having a nice arch in your foot, your arch drops. And so that then causes asymmetry in how your leg muscles are firing and puts pressure on the inside of your knees. So when you have an orthotic, it takes the stress off of the middle of the knees, and that alleviates stress on the hips and lower back as well. So if you have very high arches, this is called supination, and it's the opposite of pronation. So when the ankles lean outward, they're away from the midline of the body, and that puts strain on your knees, hips, and lower back as well. Orthotics can also help with athletic performance, so it can enhance how well you're able to shift your weight, and it also can reduce the risk of foot and ankle and knee injuries by having proper support under your feet. All right, so let's talk about plantar fasciitis. It's a type of repetitive strain injury that afflicts runners and walkers and hikers and nearly anyone who stands for a living. So when you're walking on concrete all day or you're running on the pavement, these are two of the biggest risk factors for plantar fasciitis. So pain commonly is experienced in the arch or the heel. And I'll just turn the foot this way. So the pain is experienced in the arch or in the heel. And plantar fasciitis is not the same as having flat feet. So while you can have a pronated foot cause some of the discomfort, they're completely different. And the insoles can help to mitigate the pain and discomfort from the plantar fasciitis. And the right support can minimize the stress and stretching that occurs when you're standing and walking. So imagine that there's a big, thick piece of tissue under your foot, and plantar fasciitis occurs when that tissue becomes inflamed and really rigid and tight, and it starts to pull from the bones on the heel and the metatarsals. And sometimes that can lead to heel spurs or other spurs in the foot. So when you're able to support your foot properly, then you don't overstretch these structures as you stand and you walk. And orthotic insoles and shoes with good shock absorption can help to reduce that pressure. There's arthritis in the foot, and anything when you have a term that says itis, it means inflammation. So arthritis is inflammation of the arthro, which is the joints, and that can cause pain and stiffness. There are more than 100 forms of arthritis, many of which affect the foot and the ankle. And orthotics for arthritis should provide comfortable arch support and distribute the pressure evenly in the foot and allow for extra cushioning. So it can help relieve stress on the joints, it can reduce pronation, it can reduce foot deformities, and it can improve the alignment of the body's posture, and it can reduce pressure points on the bottom of the foot as well. Foot issues that are common, foot issues are common in diabetic sufferers. Poor circulation and neuropathy can cause what's called diabetic foot conditions. So when you have a custom insole, it can be fitted to prevent specific foot conditions from developing. So a diabetic orthotic can help avoid pressure sores from developing as a result of your foot friction inside your shoe. And overpronation is common. Is very common, a common cause of excess friction and pressure on the foot. So the orthotics can help to prevent that overpronation. And they can then evenly distribute their weight over the entire source of their foot, as opposed to having that lowered arch where your foot falls in. So diabetic insoles are usually covered with a unique material that helps to conform rapidly to the individual's foot. So you get your orthotic, but then you get a nice pad of cushion on top that's going to help to absorb some of the pressures in your foot as you stand and you walk. Metatarsalgia, your metatarsals are right here in the front part of your foot. And the metatarsals, metatarsalgia is basically pain in the forefoot. And correcting this issue can be challenging because it's vague for, what's actually causing it. It's just a name for the symptoms. But when you use orthotics to treat metatarsalgia, what happens is the metatarsal pads that we put at the base of the orthotic lift the metatarsals up so that they can allow for proper sequencing in how the metatarsals come in contact with the floor as you walk. So your doctor can help determine the proper placement for these metatarsal pads in order to get you the optimum amount of relief for your specific issue. Back pain can be a complicated condition to treat, but orthotics can play a big role in helping you feel better. For example, you can use heel lifts to treat a leg length inequality. So sometimes you have a pelvis rotation that's causing one leg to be longer than the other. So you can put a heel lift in to support your foot when you're walking so you hit the ground a little bit more evenly. People sometimes do have a difference with one leg being longer than the other, so a heel lift can help with that. Obviously, we would want to go in and try and help balance out the pelvis wherever possible so that it's not causing this leg length, functional leg length problem. Also, orthotics can be used to treat repetitive strain injuries that runners and walkers and hikers experience. So if you get repetitive strains, if you get the proper supports under your feet, then that may help to prevent or absorb the shock when you're running and walking, that it can prevent all that biomechanical compensation patterns from occurring in your body. So you will feel less pain in your lower back. So when you want to improve your posture, you have to start with your feet because poor posture can do more damage than people realize. Some of the negative results for having poor posture include muscle soreness, subluxations, which is a chiropractic term that means that the joint complex is not functioning properly, and there are a variety of components with that include the actual bones and joints, the soft tissues around, the neurological structures, the nerves, and the blood vessels. And so that whole complex doesn't work properly. Poor posture can cause blood vessel constriction and nerve constrictions. It can even affect your emotional well-being and your self-confidence. So the core is typically what people aim to improve when they're correcting poor posture. They're focusing on their abs and their back. But don't forget about the feet. If you have good arch support under your feet, then you won't have compensatory mechanisms happening with some muscles being tighter than the other because you don't have a good balance at your foundation. So you want to distribute your weight more effectively, and ultimately orthotics can help you improve your posture. So what do you need to look for orthotics to improve your posture? Well, first of all, think about the weight of the orthotic, right? So if you have a slim orthotic that can fit into your shoes, that's going to be more advantageous compared to having heavy orthotic shoes that you have to basically lift and carry around. It kind of negates the positive postural effects of using orthotics. It's important to have the right support. So if you have an orthotic that offers cushioning as well as the arch support, then that's going to be good for you. If you buy an orthotic at your local grocery store or drugstore, and you can basically crush that orthotic in your hand, it's not going to stand up well to walking, running, jumping, or any other type of loading you're going to place on your feet. It's just like wearing a little cushion under your shoe. It might feel good for a short period of time, but it doesn't fix a problem. You need to look at trying to fix a problem, which is the pronation or supination or other biomechanical problem with the way that your foot is functioning when it walks. So you want to try and get the support you need, the structures in the orthotic that are going to help to correct for the individual problems with timing and pressure on your foot. And technology is the key to this, right? It provides data that the naked eye can't see. So if you want to get the best orthotic for your foot, you need the technology in order to help provide the data that you need to correct. So the human foot is a masterpiece of engineering and work of art. And that's what Leonardo Da Vinci had said. Our feet are taken for granted. Just think about where you would be without them. So let's do a quick overview here. When it comes to orthotics, there's no shortage of options. Depending on your specific needs, you need to choose the right orthotic. For chronic conditions or long-term use, use a custom orthotic. That is ideal. Come see me or someone who has computerized technology that can help identify specifics on the problems in your feet. And there are various different additions and modifications you could do to the orthotic, including cushioning. Ultimately, you don't want the orthotic big and bulky. You want it slim and fitting into your shoe while it provides you with the appropriate arch support and other features that you require. If you have minor ailments, you might want to try a prefabricated support, but eventually you probably will need custom fitted orthotics. And orthotics work like braces on your teeth. You always have to get your braces adjusted over time. So your orthotics, once you get your first pair, in a year or 2 years, you would get fitted for another pair that adds to the correction. And so the computer GaitScan technology helps with that because we have your data from the very first time, and we can measure how your feet are changing over time in order to determine what type of orthotic you need to best suit your needs. I also want to take this opportunity real quick to mention that there are different orthotics. So there are orthotics that are made wider to give you wider support, such as golfers who want to be on the court and need to have a little bit wider support in their feet. There are also orthotics that are created very slim, such as those that would fit in like a dress pump, or if you are a speed skater and you have a very tight fitting skate and you need a narrow orthotic, you can have skating orthotics created for you. So there's lots of different types of orthotics that we can use depending on what you require. There are resources that were used for this presentation. As always, I will post these in the notes section for the video that I'm uploading on YouTube, as well as the video, as well as the email that you're going to get after this presentation, so that you have access to these resources and can look at more ways you can learn more about custom orthotics. So thank you so much for being here today. You know, I know how it can be quite busy for some people to get away in the middle of their day to come out for a webinar. I know that when it comes to foot health, we often don't pay too much attention to it unless there's an issue. But prevention is really the best medicine. They say 80% of the population have poor foot biomechanics, and since 25% of your bones in your body are located in your feet, it makes sense to pay attention to them. I always say there are 3 things you need to pay attention to. You need to pay attention to your feet. You need to pay attention to your spine, because that also offers support. And you need to pay attention to the support that you have around you, meaning the bed that you sleep in and the chair that you sit in all day. You need to make sure that those are adequate physical support for you. So those are 3 things you need to focus on for physical health. So again, prevention is the best medicine. Finding the right orthotics early can help prevent more severe conditions later on down the road. I hope that this information I shared in the class gives you information on what type of orthotic and style that you might need, And of course, you can feel free to reach out with any additional questions or concerns. I'm always happy to assist you. And everyone who is on this webinar is going to be contacted so that we can arrange for you to get a free computer GaitScan assessment to determine if you can benefit from orthotic therapy. So thanks again, and I hope you guys all have a wonderful rest of the day. Appreciate it. Take care.